So hormones, I see, can play a massive role in pain healing or tissue healing. If things are not optimized, the body doesn't have that foundational mechanism it needs to heal properly. That's where I love to work with the Protea Medical Center, where there's expert physicians in that field that can help get your hormones in that optimal place to be able to heal effectively. And with the advanced regenerative medicine techniques that we have and the hormonal optimization that they can do, that whole body approach and whole person approach leads to much better outcomes, especially in that postpartum period and even postmenopausal period where hormones are kind of all over the place.
Yeah, I think something interesting that a lot of people might not know is just how directly hormones influence your joint health. It's not just two isolated systems, your physical health and your hormonal health. Everything is working together and influencing each other. One thing in particular that's really helpful to think about and that we are managing very directly in our patients are estrogen levels, especially in that pregnancy, postpartum, and then eventually postmenopausal range or postmenopausal time periods in life. Those estrogen levels have changed dramatically. And we can see that impact many things for patients, how they feel overall, emotional wellness, anxiety, postpartum depression, all of those things come down to estrogen and those fluctuating hormone levels. But we also see an increase in pain, more joint pain, more injuries.
Yeah, so throughout pregnancy, you have a release of a hormone called relaxin. As the name suggests, it helps tissues relax, but specifically it helps ligaments relax. And the reason this is produced is so that our pelvic ligaments are able to stretch a little further than they would otherwise so that you're able to birth a child. Interestingly, both high levels of estrogen essentially prime those ligaments to be able to respond to that relaxin, and then that relaxin comes in to stretch those ligaments. In some people, those ligaments can return back to that normal tautness or tightness postpartum, but in a lot of cases that doesn't happen. And so what I tend to see in my pain patients is after they've had a child or multiple children, they start to develop low back pain, pelvic pain, but even in interesting cases, knee pain, which we'll talk about with Dr. Carl Bloom, is these ligaments don't return back to where they were before, which can lead to excess joint movement, micro movements that lead to irritation, inflammation, and degeneration a little bit quicker than they would have otherwise.